Hello, everyone. Welcome back to the Eat, Burn, Sleep podcast. Today, we're going to be talking about the brain. My guest is a very special doctor called Seyran. She's based in Switzerland and she specializes in the brain. We're going to talk about stress and the brain, about aging and the brain, about the female brain, about the effect of fasting and the brain, and about stress management. Seyran and I have met actually through social media. She is a doctor, medical doctor who graduated in Germany and is now a neuroradiologist based in Switzerland. She worked at the University Hospital in Zurich and she is the founder of Brain and Synapse since 2012. She specializes in stress management. She's a teacher in meditation, Qigong, and autogenes training. She teaches and works with medical and psychology students as well and holds lectures on a regular basis. Hi, Saran. Thank you so much for joining us today.
Thank you, Yalda, for your introduction, and thank you that I'm here to talk about my topics with you.
So, just to all our listeners, Saran is a German speaker and I think she speaks perfect English, but she sometimes is stressed about her English. But to me, she's fantastic. We've had numerous conversations on Zoom and I found her so fascinating that I wanted to share with you her knowledge and I wanted to have her on the podcast today. So, Saran, I want to understand first what do you deal with on a day to day basis in your practice?
Most of my patients, they have stress symptoms. If I deal with the patients, we are training in stress management. It is a one-by-one training, and they came with sleep disturbance, anxiety, or mild depression. They suffer from low energy, and brain fog always is a symptom what we are dealing with, and they often suffer from fatigue, tired, and list goes on in this way.
Yeah, brain fog being very linked to neuroinflammation. That's something that I see regularly with people on Eat, Burn, Sleep. When they start adopting an anti inflammatory lifestyle, from the first week, the brain clears because you reduce neuroinflammation. So I'm very interested in the brain and aging. A lot of people tend to focus on the outside signs of aging, but I'm actually more interested on the inside signs of aging. So, for example, I really care about bone health, about bone density, muscle density, and we don't have that many tools to measure how our brain is aging. We all to a certain extent suffer from chronic stress because of the way we live our lives now, the way society is structured, the way social interactions are structured, the way we now work on screens and have less social interactions through work than we used to have. So my question is, how does chronic stress impact the brain's structure and function, particularly in relation to aging? And what role can neuroradiology play in understanding these changes?
It is a big topic and a great question, Yalda. It is important to know that we, in a state of chronic stress, that we have a high level of cortisol in our blood circulation. And first of all, I would like to explain what means that we have cortisol in our body. They have two functions. The first is the good part, and we have a bad part from cortisol. The good part is that we generally need for our survival the cortisol level. And this means we are in a circadian rhythm. It means that the body produces cortisol regularly, and the peak is in the morning at 6, 8 o'clock. And during day the cortisol level decrease. And if we are getting in an acute stress situation, so the body is producing more cortisol because we need at this time the energy, the power to solve the acute situation. And after the acute situation, the cortisol decreases again and stabilize. And at the state of chronic stress, you have to think there are mechanisms that will be activated for a long time. It's not a short time, it's a long time. Maybe it's few weeks, months, or years. And at this time, we have a cortisol level is always increased. It doesn't decrease again. So we know that this impact our body and also our brain. And I'm very interested in brain function and structure and to see what does it means for our brain when cortisol is very high. At the level, there are so many researches done about this field. They looked what are the symptoms, what we are dealing with, and then secondly, they look to the brain regions. And the affected regions are, for example, the hippocampus, our memory center, or the prefrontal cortex, some to give you some explanations. And they impacted because these areas get thinner. They lose volume in the brain. And the other thing is, if we are dealing with anxiety, this part is the amygdala and it creases. This is the impact from stress, high cortisol level, and the some mentioned brain areas.
That's why when we stress, we can't think. When we have high anxiety, the thinking brain just shuts down. A typical example is I was trying to explain this to my children because one of my children had an exam in French and he speaks fluent French. His brain froze and he couldn't find some basic words. So I gave him some breathing techniques to immediately drop cortisol so his brain function could restart during an exam. I said, whenever your brain freezes, is because you're stressed or you've held your breath. So if you focus on breathing again, your brain will start working again. And I have experienced myself actually complete short term memory loss triggered by high cortisol to the point that I thought I had a problem and I insisted on having a brain MRI scan when actually it was only linked to high cortisol. But my next question is how do we measure elevated chronic cortisol?
You can measure it in the blood.
Okay, so we can just go to the doctor and ask our cortisol levels to be measured
Yes.
and check. That's interesting. Maybe we should all do that. In your experience as a neuroradiologist and trainer in stress management, what imaging findings have you observed in patients where stress may have contributed to accelerated brain aging? And how does this tie into the broader understanding of neurological health?
In my practice, if I deal with my patient one by one, I do not usually do an MRI scan from the brain. But I'm working with colleagues together, they are neurologists or psychiatrists, and the patients have other conditions, so they are checked up mostly with an MRI scan because other diseases. So as a neuroradiologist, I'm very interested about for my patient the pictures, the imaging to see maybe I can correlate about some areas is it evolved. And what I see, but I will give you a few examples of my experience is residency. I had key moments in my practice where I see patients maybe for a follow up. The first image was great and came back, and I saw the images again and said, oh my God, a significantly different brain. And so I went to the patient and said, oh my God, it's maybe the different patients. And we asked the name, everything is okay, and everything was correct. But the patient was in therapy, what we didn't know. And he was in high cortisol therapy. So he was in a hypercortisolism state, and the brain changes in globally. It lose on volume from the brain, and I was so shocked about it because I didn't know it before. And afterwards, he came back 8, 9 months later to check up how it's the brain work or look like in structure, and everything disappear. And it was a moment that okay, something is possible to change in a better way. The other thing is I have a lot of experience with patients with Cushing disease. I saw so many patients. Cushing disease is hormone producing tumor in our body, and it is producing cortisol, and the level is very, very high in our body. And also at the same time there are brain changes, maybe in the white matter, or the gray matter is thinner. And also we see not structural changes, also in the function. And Cushing disease is a well-known disease, and there are so many publications about it where we correlate depression, anxiety, and also bipolar disorders. They are in combination. They know it. And also the cognition is impaired at this patient. We know it. If you know they have Cushing disease, they are hypercortisolism, and they have this neuropathological disorders at the same time. But everybody is not the same involvement. It impacts the function and the structure of the brain. Yeah, there's two cases I can tell you how it is impacting.
So higher cortisol basically shrinks the size of the brain.
Yes, yes.
Interesting. What do you mean by he was in high cortisol therapy? What is that?
If you have an illness, a disorder, they get cortisol therapy, and the level they get impact the brain.
I see. I see. I thought like some form of talking therapy triggered cortisol. I see. That's very interesting. And I remember when I was at nutrition school, we had to write papers. And I like to write papers about things that were not my specialty. And back then, of course, coming from a background of inflammatory bowel disease, I didn't want to write things about the digestive system because I felt like I knew it pretty well. So I would always pick topics where I didn't have that much knowledge, and I picked polycystic ovary syndrome,
Yes.
endometriosis, and then for my last paper, the bigger one, which I wrote 28 pages, I picked depression. I was stunned by all the studies linking higher inflammatory markers and the onset of depression, the medication resistance that can happen with depression and patients put on antidepressants, the occurrence of bipolar disorder and schizophrenia.
Yeah.
So these people show higher ESR and CRP levels in their blood. And it made me understand that it doesn't matter how many sessions you get with a psychotherapist. If you're not working on lifestyle changes to reduce your blood inflammatory markers, you cannot fully heal from bipolar disorder, schizophrenia, or depression.
Yes. I think, in my opinion, is stress is fuel for the inflammation. If you manage your stress, because stress gives you the cortisol level up increases. If you stress out, you activate two systems in your body. You activate the autonomic system. This is a sympathetic pathway. Adrenaline goes running, noradrenaline is running. And the second part is you activate the endocrine system. And the endocrine system is cortisol. And we have a hierarchy of hormones. And if we activate the survival hormone, it is a cortisol hormone. Everything else stops.
Exactly. The presence of cortisol triggers the, as you say, the autonomic nervous system and the sympathetic nervous system, which is the fight and flight, and it turns off rest and digest and reproduce. Because when we need to run away from a threat, we don't need to fight a virus, we don't need to have a baby, and we don't need to go to the bathroom. We need to run.
Yes, yes.
And cortisol being a hormone, it triggers the hormone cascade, and every single hormone in the body gets negatively impacted by high cortisol levels.
And they are blocked because cortisol is higher than the other hormones. Because you are fighting, you are in a survival mode. How you explain? You cannot go with the other hormones because they are blocked. The body has to produce cortisol for survive.
Yes, so survival becomes the priority.
Yes,
Cortisol becomes the dominant hormone. With that in mind, I want to remind our listeners, or maybe you guys don't know about this, but what you put in your mouth greatly influences your cortisol levels.
yes,
Meditating and telling yourself, oh, I need to not stress, will not be enough. You know how you're stressed and someone says to you, well, you need to stress less. There's nothing more annoying than that because if we could just say, I need to stress less, we would stress less. But things that elevate your stress are inflammatory foods, foods that disrupt your gut health, because the majority of your neurotransmitters, serotonin, melatonin, dopamine, GABA, are produced in the gastrointestinal tract. And lack of sleep, obviously, all these things, what you put in your mouth really influences your cortisol levels. And there is something people don't realize is they can reach for sugar because it's soothing. The reason why sugar is soothing is sugar increases your insulin. So, in the short run, you have an increase in serotonin because insulin is the precursor to serotonin. So, you have an immediate feel good effect. But the problem is your blood sugar levels, then on the back of that, if they go too high, you start having lower blood sugar levels thanks to that insulin. So, you get a little crash, and that can create anxiety. You can go from hyperglycemia to hypoglycemia, leading to stress and in turn higher cortisol levels. So you're stuck in this loop of a little high because of sugar and feeling low. And then you need the sugar again. So you're craving sugar. And typically, these people live off sugar and coffee. And they're on this cortisol, high insulin, hyperglycemia, hypoglycemia roller coaster, and they have terrible mental well being. So don't use sugar as a feel good food because it only feels good for 5 minutes. It feels terrible throughout the day. In a nutshell, your foods have a high impact on your stress levels. The way I've structured the meal planner on the Eat, Burn, Sleep lifestyle, coupled with the movement videos, which serve as a little mindfulness every day on your mat for 20 minutes, the way I conduct these workouts so they don't trigger your cortisol, really helps calm you down. I see it myself. So I started 10 days ago going on a little liver detox cleanse on the Eat, Burn, Sleep platform. And the amount of work that I managed to get done is quite incredible because my brain is functioning better. Everything is easier and I get less overwhelmed. When I eat more of the red foods that are on the food list on the Eat, Burn, Sleep platform, I tend to get more overwhelmed, more anxious. I feel like I can't cope as much as when I'm good with my food. So the impact of food and exercise on anxiety, on brain function is absolutely huge. So, with that, considering the intersection of neuroradiology and nutrition, I want to know from your experience, what role does a well balanced diet play in mitigating the impact of stress on the aging brain? It's time for a little break. Hey everyone, I hope you're enjoying today's podcast. A reminder to all our listeners to subscribe, rate, and share this podcast with your friends and anyone who might enjoy listening to it. We also have a discount code for all our podcast listeners, which I will be sharing at the end. Keep listening, and I hope you enjoy the rest of this episode. what role does a well balanced diet play in mitigating the impact of stress on the aging brain? And are there any specific nutrients that are particularly beneficial?
Yes, there are also a lot of research done, Yalda, at this field. And I would like to mention one done in 2023 in the University as Illinois. They could measure three components independently predicting the aging. It was the nutrition intake and the impact to the brain structure and also the cognition function. And also other research done at this field. We know maybe it's a high cardiovascular risk, maybe if we eat high processed food or very fatty acids food, and they have systemic results of our body in inflammation, cardiovascular disorders, and also the endothelial function is involved. And we don't think about our brain when so many organs are involved. The brain is also an organ, so it is also involved. And what we know is from the cortisol point, it breaks the blood brain barrier. So we have at the brain receptor, they are communicating and can develop the function in the brain. And the location and various vulnerable areas that I mentioned before is our memory center, the hippocampus, our center of anxiety, the amygdala, and where our attention function is located is the prefrontal cortex. These areas are very vulnerable for changes and the foods. And I would like to mention also the lifestyle. I would say lifestyle is not a diet for me. It's Mediterranean. It's always said the diet, but I think it's more important to mention the lifestyle of Mediterranean. We have good foods, vegetables, eggs, lean meat, and this impact our brain, how we have a lifestyle. And I love your platform because you have all the components that we have to activate to get a good brain health, and not a good diet or just a good exercise. It is a combination of all these things, and this is essential. And what we also know is the intake maybe from flavonoids. It is neuroprotective. And they measured also areas of the brain, maybe the hippocampus or the gray matter. How will they impact? Today you can measure all these with the MRI scan or special scans to correlate the impact of what is your nutrition intake and what is this changing in your brain. It's very interesting.
Amazing. So you're mentioning that cortisol breaks the brain blood barrier. I just want to clarify for our listeners that the brain obviously is a really fragile, soft organ, and that's why we have skull, which is very hard to protect it. It's got the consistency of maybe some kind of soft cheese, maybe mozzarella, even softer than that. So we have the skull to protect it, and then we have the blood brain barrier to protect the brain from toxins, from all sorts of things that can circulate in our body. The fact that cortisol crosses it, I'm suspecting from what you're saying, this is what creates the shrinking of the brain. So, cortisol is effectively a real toxin when it comes to brain health.
In a very high level. If we are in a chronic stress mode, we have high cortisol level, and this impacts our health, our mental health.
Absolutely. And I love the fact that you have mentioned flavonoids and micronutrients because we had all different trends. There used to be the vegan diet, and everyone was all about being vegan, not realizing we needed the full chain of amino acids and all the proteins for muscle repair, for organs repair, and skin being our biggest organ, and of course for the brain. And I would often get hate on social media when I would mention this. Now the trend has changed, but up to a year ago, or actually up to COVID, veganism was a big trend. And of course, it's a really commercial one. There is a reason why it's trending so much. First and foremost, it's much easier and cheaper to serve a plate of vegan protein than animal protein. For a restaurant, for any food manufacturer, vegan food is cheap and really high margins. But let's not talk about that. Let's talk about the hate that I used to get. And I would sometimes joke back to my haters saying, well, you see, you're vegan, and the reason why you're so angry is because you have neuroinflammation. But I actually meant it. It was a joke, but I meant it because in a vegan diet, you have really high carbohydrates by definition. And so that will elevate your cortisol levels because of what we've just spoken. Your insulin will be elevated, and you're not getting the full chain of amino acids for brain repair. So, anyone who's suffering from depression, anxiety, and is vegan will feel such a sense of relief when they start reintroducing animal products. And in fact, I've created a section on the platform to guide people through that process. But the second thing I wanted to talk about from what you've just said, you've mentioned flavonoids and micronutrients. And now the new trend is protein. People just say you need 100 grams of protein a day if you're a woman, or you need a gram of protein a day per pound of body weight. And I was explaining to my children, who of course follow such social media accounts, they're teenagers, and they were like, oh, I need my protein. And I was explaining to them that in a protein shake, even if it's probably better for you to have a protein shake than a bar of highly processed chocolate or candy, it is still processed and you're not getting the micronutrients needed for absorption. So I said to them, you're better off having a piece of fish if you can, because you need all the cofactors and you want to have vegetables with it. And you can't substitute food with powders. It doesn't work like that. We need the macronutrients and we need the micronutrients. And also, when it comes to absorption, I was explaining to them, and they didn't realize that. I guess many people don't realize that when you're eating protein at the beginning of the meal, your absorption is greater because the body is clever. The body needs the protein, so at the beginning of the meal, it's absorbing a lot. And towards the end of the meal, because it has absorbed quite a bit, there is some that it will not absorb. So I was saying to them, not only you want to have it in food form, but you're much better off having it over 3 meals a day than having one big sitting. And right now, a lot of people are doing the OMAD diet, which is 1 meal a day, and they're counting their macronutrients, thinking they're hitting them, but actually, they're not absorbing them in the same way than if it's spread over several meals. So I like to mention all these little details so people understand that common sense, which is don't snack between your meals, so your blood sugar levels are not elevated all the time. Follow the meal planner on Eat, Burn, Sleep, and you'll get optimal health results. You don't need to go extreme or buy anything fancy or anything processed that's tagged organic or super healthy. You don't need health foods. You need good quality foods and following an anti
Absolutely.
inflammatory lifestyle.
Yes, absolutely.
So I'm very interested in case studies with my work. What I find the most motivating is case studies, people who have overcome psoriasis or alopecia or even depression or extreme weight gain. So could you share with us any intriguing case studies or findings where the combination of neuroradiology insights and nutritional interventions has led to positive outcomes in managing or preventing accelerated brain aging due to stress?
Yes, in the state of chronic stress, we need a lot of nutrition. And the intake of nutrition is today very low. And what we see, maybe in neuroradiology, I make the experience to see cases of vitamin B12 deficiency. And it was for me, it cannot be possible that we are in deficiency in Europe, maybe, or in Switzerland. So it not be possible. And what we see, the changes in the brain or in the spinal cord, is we see lesions there. So if give us the link to the clinician and say, okay, in the spinal cord and the dorsal column, we have the sign, we have the lesion. Maybe it is linked to a vitamin B12 deficiency. So we can go from the image to the clinician and can give the link what is going on. And I made experience few times that correlates. We have brain changes that is not so specific like the spinal cord changes, and they can be therapied, get in therapy. And vitamin B12 is so crucial for our system because it leads to neuropathological disorders. And they made studies few years ago and controlled, measured men, women, how their level of B12 is. They were always very low. Men till 50%, women especially till 30%. And I think it's the huge level. The vitamin B12 deficiency lead to neuropathological disorders, and most of them they don't know the deficiency and no correlation between the vitamin B12 deficiency and the symptoms.
And do you think that this B12 deficiency is caused by malabsorption or the fact that vegetarian and vegan diets are so popular? Because we find B12 mainly in animal products. So if you're not eating animal products, you might be deficient in B12.
Yes, most of them B12 is in meat. And if you have disorders from gastritis or other conditions from the tract, it can be involved. That the absorption is not properly, but most of vitamin B12 is in the meat. And you have to substitute this patient, this person with vitamin B12. And for a long time, it will be good. They have vitamin 12, maybe you say 2, 3 years, the depot is full of vitamin B12, then it decreases. It's a slowly go down, and then the symptoms rise up.
Interesting. Vitamin B12 is absolutely key for the central nervous system. Just to give you an example, if someone is deficient in B12, they can develop neurological issues that can actually sometimes not be reversible. That's how damaging it is. I know a horror story from an anesthetist who told me this. She follows me on Instagram, and when I was talking about the fact that being vegan was not healthy, she said to me that they had a case where a lady who was vegan came for surgery. She didn't say she was vegan. She had almost no B12 in her system, and she stayed paralyzed when she woke up from general anesthetic. A problem with the detection of low vitamin B12 these days is in the old days, when you had low vitamin B12, you had something we call megaloblastic anemia, where your red blood cells were enlarged, and that gave a sign to your doctor that they should investigate and maybe your B12 was low. But unfortunately, as a lot of foods are fortified in B9 with folic acid, megaloblastic anemia doesn't happen as much in patients with low vitamin B12. So it's becoming harder to detect when people have low B12. And it is so dangerous. So I recommend for most people who either have digestive issues or are vegetarian or vegan to supplement in vitamin B12. And also another thing, B12, you can't really overdose it. So it is a safe vitamin to supplement with. I forgot what is the maximum, but it's not going to harm you. Like if you were supplementing with iron, that can be dangerous if you overdo it. But vitamin B12, doing a little course a couple of times a year is probably a good idea.
I would add that vitamin B12 deficiency can have big neurological complications. So maybe the patient have ataxia. You'd never come to the idea it could be the vitamin B12 deficiency. Or you have cognitive impairment. You don't think about first vitamin B12, but you have to see all the person, how is the lifestyle, what is the diet, what is the impact of his life. And so it is like research of many things. You are searching all the time what could be the reason of the problem. And with ataxia, it's huge spectrum what could produce ataxia maybe.
Vitamin B12 is so important for good functioning of the central nervous system. And as Seyran was saying, ataxia, which is a condition that affects coordination, balance, and speech, can be caused by vitamin deficiencies, by vitamin B12 deficiency, by vitamin E deficiency. So there's a huge impact of vitamin deficiencies on brain function. And this brings me back to what I was saying earlier. We want to have a plate of food with anti inflammatory foods, with all the cofactors necessary for absorption. And some vitamins are not as well absorbed when they are made synthetically. So, indeed, I recommend testing your vitamin levels, but also really working on having a healthy diet. Seyran, thank you so much for this time with us. I will be linking your website and your Instagram page and everything so people can find you. It's always fascinating to talk with people like you and understand more that mental health conditions are not healed by just taking a pill or talking to a therapist. There is so much more to it. And you know what pleases me is the word is going around in the medical field and also in universities. And in fact, I've been asked by a university in the UK to come and talk to students in psychology about the positive impact of nutrition. And I will be certainly mentioning you and our conversation today. I think that's really important for them to understand that all the things we have discussed today. Thank you so much, Seyran, for your time.
Thank you, Yalda, for having me here and that we can talk about a very, very important topic, the brain topic. And I thank you so much for your platform that is so informative and based on research. I'm so happy to find you on the social media to get connected. And also, I can learn so much from your work. And thank you for having me here.
Thank you. That is very humbling. Thank you so much for your kind words, Seyran. And to all of you who listened, I hope you enjoyed this podcast. And make sure to subscribe, share, and rate it. Thank you. Thank you so much to all of you for listening to this podcast today. I hope you enjoyed it. It's always such a pleasure to talk about health because it's not about the destination, it's about the journey. Looking after our health is a daily thing, just like brushing our teeth. We've got to focus on it, we've got to do it right so we can live better and happier lives. For those of you who are not members of the platform yet, we have a discount code for all our podcast listeners. You can get 15% off the memberships. Just enter the code podcast15 at checkout. Thank you, and make sure to read all the articles and all the free content we have on eatburnsleep.com to keep you motivated and informed and educated about living an anti-inflammatory lifestyle.